Department of Children and Family Services.
I'm about now instead of spending a lot of big money. I believe we need to take care of people, but we need to be able to coordinate that care. We never think about coordinating care in juvenile facilities, and
Good afternoon, Madam Secretary. I see that you have a whole group with you today. I've been told that most of the folks in the audience are from DCFS.
Yes, ma'am.
Okay, so let me see who we have at the table. Brenda, Terry, Stacy. I'm trying to see who's all speaking. Okay. All right. So we will start with you, Madam Secretary, and let you just provide us with an update. But before you do, because let me make this disclosure. So Department of Children and Family Services was added to the agenda after the recent situation with two cases that happened. One was with the baby, Mitchell Robertson, 2 years old, who happens to live in my district, who died as a result of an overdose of fentanyl after being rushed to the hospital on the third time. And then the other situation that recently came up was Friday, that I found out Friday afternoon, with the Haddon family, which also, if they are not in my district, they are right on the border of my district, in the Zachary area. And so while I know that the secretary nor her staff can answer any questions regarding those cases, we do want to talk about procedurally what happens with the department. And so I want to make sure I make that disclaimer first. But you guys heard me a few moments ago and about children, and anybody that know me know how passionate I am about young people. It's ironic that we would have juvenile services come up before you guys, because many of these children, I believe, who end up in juvenile services or juvenile justice, come as a result of what happened to them early on. Which is part of the responsibility that you guys have. So I want to make sure I make that disclaimer first, and asking that we kind of make sure that we ask the questions as they relate to procedures that happens with the department. And Madam Secretary, I received a lot of information, but I don't think I received everything from you all as a result from questions that were asked early on, maybe a week or so ago, from health and welfare. Yes. But seemed like, and I'm not sure, but seemed like I had some missing aspects, and y'all can tell me if it was, because if I'm looking at the number, and if it's going numerically, it just seemed like some things were missing. But y'all can tell me if it is or not. Okay, so with that, we'll stop.
Thank you. Marquita Garner-Walters, Secretary of the Department of Children and Family Services. Senators, you know that I asked for this job, and I asked for it because I wanted to repair the safety net for children and families that had been damaged in the previous administration. From my earliest days at Prevent Child Abuse Louisiana, I've been advocating for keeping children safe, for building stronger communities, and for supporting fragile families. I am heartbroken over this child's death. I am heartbroken at the loss of any child, especially one that has had some contact with our agency, because it means the safety net that we are supposed to have as a society is not strong enough. As an agency, this staff, these people behind me, have committed their lives to working in this field to support fragile families and to protect children. They are all devastated. We are all just gutted by this, because we know our job, and we are determined and committed to finding what went wrong and to find solutions, and to do that immediately. I know you've called us here to account for what went wrong, because I know you're just as concerned about this as I am, because I know you. I have worked with you. I have worked alongside you to do better things for children and families, to raise the age of foster care, to do better human trafficking work, to have better programs in place, and to access every penny that we can get from outside providers and from the federal government to strengthen what was damaged in the previous administration. And Senator Jackson, I so appreciate what you said earlier to my colleague, because every step of the way since we walked in the door, we have been tackling problems that in large part are due to the loss of the 500 child welfare professionals that we still have not replaced. 500 more people. What would we look like if we had that kind of capacity? When we walked in the door, we knew that we could not do foster care the way we used to do it because we didn't have that 500 staff. So we looked for a new way to do foster care and implemented the quality parenting initiative that creates more of a triangle between a caseworker, a birth family, and a foster family. We knew we could not support foster parents because we didn't have enough human beings to do that. So we worked with the First Lady to create Louisiana Fosters to get the community to do the job of supporting foster parents. At every turn, we have been trying to build and strengthen the safety net for children. And in an effort to be as transparent as we possibly can, we want to provide you all the information that we can and to answer your questions. And we know that we're not going to answer every single one of them because we don't have the answer, and we haven't answered all of our internal questions. We started our own investigation the moment we learned about this case, and we are looking at every aspect of the case to determine every step we took, right or wrong, good or bad, where were we, how did we do, and what can we do differently so it doesn't happen again. Our investigations take time. They do not fit a news cycle. It takes days and weeks and maybe even months to get to, because we are pulling from 5 antiquated systems. We are interviewing all community stakeholders. We're working with law enforcement. We're working with hospitals. We're pulling documents from everybody, because when we create the record, we want that record to be accurate. And we can't do that to hit the 5 o'clock news. And we never will do that to hit the 5 o'clock news, because I'm not going to go spout off something that I don't know is accurate and true. So we want to know what happens, and we want to be able to fix it. And we are here to answer your questions to our very best knowledge. Dr. Hodnett is here, who is our child welfare director. She has a plethora of staff behind her, because child welfare is a big term. It covers a multitude of specialties. And so we have people in the room from each specialty area, so that if you have questions about intake or about investigation or about the Baton Rouge office in particular, because that's where so many of these really horrific cases have come in this region, then we have staff to cover all of that. I'm also joined today by my Deputy Secretary, Terry Ricks, and I have asked her to talk for a minute before we get into the questions with Dr. Hodnett and her team about the other work that we are doing internally to support children and families.
Thank you, Madam Secretary. Yes. Madam Chair and Senators, I'm Terry Ricks. I'm the Deputy Secretary of the Department, and I wanted to be able just to put into context some of the work that we're doing, because child welfare never stands by itself, right? There's always crossover into other programs, and when we talk about what's going on in child welfare, we're going to be talking about various things, but never do we do work alone. And in that sense, as we're working toward our mission and we're trying to work on our values in the department across the enterprise and through out the state enterprise, the state as an enterprise, we've been working with other state agencies. We've been working on not only increasing our poverty competencies in the department to understand where does poverty fit into all of this, to really move from an agency that administers programs, but to move to eradicating poverty, to make sure that we're looking at equitable outcomes, making decisions that are data-driven, using evidence-based practices, changing policies. In our review of those things, it brings us to lots of research, efforts that are happening in other states, other jurisdictions. You know how close we have to work with education, with law enforcement. And recently, we were looking at a U.S. Department of Justice's report that's entitled Law Enforcement's Response to Child Abuse. And it says that child abuse is a community problem. No single agency has the training, manpower, resources, or legal mandate to intervene effectively in child abuse cases. No one agency has the sole responsibility for dealing with abused children. When a child is physically assaulted or sexually abused, the ideal response is for doctors to treat injuries, therapists to counsel the child, social service professionals to work with the family, law enforcement officers to arrest the offender, and attorneys to prosecute the case. This is possible only if the agencies and organizations involved have an established process for working together to respond to child abuse cases. The most effective community response involves establishing a child protection team that includes professionals from the medical, mental health, criminal justice, social services, and education fields who understand and appreciate the different roles, responsibilities, strengths, and weaknesses of the other team members and cooperate and coordinate their efforts. I think this statement underscores why we are such active participants in trying to figure out how to make those connections real. And when we talk about what we are changing, we're going to see those close connections needing to be closer. As we go forward in our work, and no matter what part of DCFS, we will be working to close those connections. And so in January, we opened up we have a cooperative endeavor agreement that started in January with the Louisiana Association of United Ways to more prolifically use the 211 number. And with that, being able to use the Unite Us platform to do more closed loop referrals, et cetera. We have some infrastructure that we haven't had in the past, and we're looking forward to ways to sort of solidify and codify the close relationship that has come between the assistant secretaries in our department and through the sub-cabinet for workforce and education and through the children's cabinet, et cetera, that we can continue to grow that. And so just as a little aside, I wanted to put that out on the table for you to understand, and happy to answer any questions. But I know that the Assistant Secretary and our staff will answer more specific questions related to child welfare. But if I can provide any further information about the enterprise-wide endeavors that we're doing and being called to talk more about nationally, I'm happy to do that. Thank you.
So before we turn it over to Ms. Renette, let me ask you, because you kind of talked about what would be the ideal model, and you talked about all of the systems being in place, which we don't have. We don't have that infrastructure right now in terms of when something happens. You need to have, go back through that whole list. And if you can make that available to us, I would like to have it myself, I know for sure, but I would like to see that.
Yes, ma'am. Medical, mental health, criminal justice, social services, education, if that's the one that you were talking about.
Yes. Mm-hmm.
Okay. Yes, I'll definitely make it available to you.
I heard you say law enforcement, I think was the last
Yes,
one.
I'm sorry. Yes, ma'am. And so earlier it does say when a child is physically assaulted or sexually abused, the ideal response is for doctors to treat injuries, therapists to counsel the child, social services professionals to work with the family, law enforcement officers to arrest the offender, and attorneys to prosecute the case.
And that was only for sexual assault. Is that only for sexual assault?
No.
Okay.
All child abuse.
Oh, okay. So,
Yeah, physically assaulted or sexually
Okay.
abused. Yes, ma'am.
So we currently do not have that level of infrastructure in place.
That's right.
That is correct. And the child
And-
welfare staff would be best to be able to answer exactly
Okay.
what we do have and, how we can strengthen that. But we believe that we have more infrastructure, meaning like IT services, connections that we can make more on platforms than we could have in the past. You remember what No Wrong Door, right? We've been talking about No Wrong Door since Governor Blanco, when the secretary and I were here then. We have the actual ability to do that better than we have in the past. And I'm looking forward to us continuing to be able to do that. A closed loop referral process, like when you go to the doctor and they tell you need to go to see the physical therapist, by the next day the physical therapist is calling you, right? That's a closed loop. Our vision would have us to be able to move to that level of service to people. The other thing it does is it provides us a lot more data so that we can understand when are people being connected, what's happening to them when they get to services, and where there are no services. Right now, we sort of back into information about whether there's enough services, because sometimes people just don't refer because there's no service, but then we don't have data to show what's the unmet need.
Gotcha.
And so you might remember also that in addition to the things that we lost over the past,
Yes,
not only have we lost DCFS, child welfare employees, and others like human resources and attorneys, etc., but the community-based services were emaciated during that time, and we have not seen that. So in the end, when we talk about, when we're getting extreme increases in family violence and violence in general, when we're seeing a lack of affordable housing and what was affordable becoming less affordable, when we see not enough childcare spaces where people need them in order to go to work and a non-livable wage, I'm afraid we're in a spot where we may see more people needing safety net, and the safety net not strong enough for everybody falling through, that's coming through. And certainly we know that our major in the Department of Children and Family Services, it is people that help people. And so, we could almost reiterate what OJJ was saying when they were here with the number of vacancies, and in fact, the starting salary that they were talking about, of course, is higher at OJJ than it is for DCFS, incoming child welfare workers. So
with that, what is starting salary?
yes, ma'am. So we have that information. We just had a little increase in child welfare. We worked with civil service. And so it went from being 27, you have it written down?
From 29 to 36,000, but that for the frontline staff.
What's frontline? What's that category when you say frontline? Is that the caseworkers, or is that like secretary?
Yeah, this is the caseworker,
Case carrying
case
staff.
carrying staff, which means they've got a bachelor's degree. They're coming on.
A bachelor.
Yes,
ma'am.
At least.
At least. And so if you have a
And they make it
master's degree,
36,000.
we will be able to go higher. Yes.
And that was what we just got in January of this year from civil service, and that only applies to case carrying staff. That did not cover like adoption staff. We were very strategic in, just because it was a big financial hit, we were very strategic to only carve out the people that work on the front lines and carry caseloads and the supervision of those caseloads.
So how many caseworkers do y'all have? And I'm just kind of getting off of just maybe a little bit, but how many caseworkers do you have in Baton Rouge, and how many caseworkers do you have in the state?
Dr. Hodnett has all that information.
Okay, so is it time for us to go to you?
Yes.
Maybe.
Why don't we
Okay.
do that? Yes.
And actually, when we get to Baton Rouge, I'll let the Baton Rouge people talk. They can do it so much better than I can. But good afternoon. I'm Randa Hodnett. I'm the Assistant Secretary for Child Welfare. Before we answer questions, I would ask you to please let me just first say that as someone who has dedicated 30-plus years to this work, child welfare, public child welfare in Louisiana, I, too, am devastated by the death of this child and the recent cases we've had, by the increase in the violence that we've seen. I am as outraged as you all are, and the public is in general, that parents would perpetrate this kind of violence against innocent children, and that our system was not sufficient to prevent it. I am outraged at that. I have given my life to this work, and so have many of my team members behind me. I'm also outraged that we can't get people to come to work for us. No one wants to do this work. They do not want to go out into the conditions that our caseworkers are having to go out into. Our caseworkers are exhausted. They are afraid. They have the trauma that they bear every day is incredible. And maybe unlike Bill Summers before, who may not have known what he was getting into, when I took this position in 2016, I knew exactly what I was getting into. I knew the enormity of the problem because I was there. I was there when people couldn't really talk about how we are doing more with less and doing it well. And we weren't. And we are struggling. I took this job because, in spite of the enormity of the problems, I knew that Secretary Walters was the biggest advocate for children that there could be. And I believed that together we really could make a difference and make the improvements that needed to be made in our system. I didn't want to leave, although I could have at that point. I could have retired then. I didn't want to leave the system like it was. I wanted the chance to make improvements, and we were making improvements. We were making a lot of improvement. The pandemic dismantled the infrastructure that we had. We lost staff, we lost foster parents, we lost providers, and I will tell you, it has been an uphill battle ever since, as we've talked about many times in the committee hearings. And, as Terry said earlier, this is a social service agency. You have said often, the heart and soul of government. It's people. Yeah. We have got to have the right people who are coming here for the right reason and believe that it is a calling. It is the only thing that keeps us here. And when you think about what is expected of our caseworkers, the breadth and the scope of the work that they're expected to know and
Go
understand.
through that right quick.
Well, everything from substance-exposed newborns, infants, how to assess the needs and developmental needs and physical needs of the infants, all the way through developmental disabilities of school-age children and everything that they need, all the way through extended foster care now, teenagers and older youth who are preparing for transition to adulthood. Understanding that whole scope of age range, and then also the complexity of the issues that they face. So substance abuse, fentanyl, that is fairly new on the scene to us. Every day we're hearing more and more things that they're expected to become proficient in and really understand and know all about. Mental health issues, they're just out of control. The domestic violence, you don't just walk into a domestic violence situation without knowing what you're doing. It is a dangerous situation, not only for our staff, but for the mother or the victim and children. And so the trauma, facilitation, safety approaches, engagement. The list goes on and on and on of what they are expected to know. And the average tenure of our staff is so young now. We're talking about in Baton Rouge, you'll hear, I believe they said it's 18 months. How you cannot possibly master that kind of array
So the average time now is 18 months?
in Baton Rouge.
Oh, in Baton Rouge.
Baton Rouge.
I'm gonna have someone
Okay.
come up for Baton Rouge.
The Baton Rouge office is really, I feel like that whack-a-mole game. So sometimes it's one area, we put all of our resources there, and then it pops up in another. And so New Orleans has been a really difficult place. That New Orleans region has suffered a lot, and it's been hard to attract staff there. Baton Rouge has equally been challenged with staffing, with community problems. And so I have the
Who's the Baton Rouge person?
regional administrator and the area director there, Anthony Ellis and Fertasia Broussard, and
Okay.
they can tell you what the current situation is in Baton
So
Rouge.
$36,000, is that the start pay, or because I know there's a range, right, that they can go up to. So the starting pay is 36,000, but they can go up based upon other factors. Am I correct?
Yes, as they move up and gain experience and have time with us.
Okay.
The
But they never get there if they just there 18 months, right?
Yes, ma'am, that's correct. So if someone were wanting to come and work with us, and we make that appeal right now because we need you, is they could start off as a specialist and they would make the 36. If they were to stay, just about each successful year, they could have a career progression. If they stay around with us for about 4 years, they'll make it to 50. And so there's an incentive built in through the civil service process that if someone stays successfully, then they can continually, raise their income. And so we are working to try to better sell that to people, but getting through training and feeling like you can actually do the job is more important to anybody's work-life balance. And I think in the end, I might give up a few coins, which in today's dates, you really wouldn't have to give up coins in order to be able to leave the job when you knock off, as my dad used to say. So you okay if I have the Baton Rouge
Sure.
group come in?
Good evening. I'm Fertasia Broussard, the area director for Baton Rouge Region.
Okay.
And I'm Anthony Ellis, the regional administrator for Baton Rouge Region.
So I know I want to turn it over because the board is lit up, and so I want to give everybody an opportunity to ask questions. But I do want to talk about Baton Rouge for a while because I've heard that Baton Rouge is definitely one of the issues that we have. I heard that before the meeting today. What is actually the chain of command, and what are the levels? So like certain cases have certain levels, right? They require more attention, or it requires that you have to respond within a certain amount of time. So I've heard about the 24 hours, 48 hours, and I'm not sure if it's level 1, level 2, or if y'all call it something else. But I want to know about that process, and then I want to know about the chain of command in terms of who reports to who. The caseworker is the person, I guess, initially, right? So y'all help me if I'm not correct. The caseworker is the person who first come in contact maybe with the family or whoever makes the phone call.
That's correct.
So then who comes after them, and when does it get to you, Mr. Ellis?
Well, the chain of command is I'm the regional administrator, and which is basically have oversight of the region. Ms. Broussard is actually our area director, so she is pretty much there in the office responsible for, the staffing and stuff like that. Under her, we have a leadership team which includes child welfare managers. And so under the managers is the supervisors, and then there is the frontline staff, which is our workers.
Okay.
So there are several layers of administrative oversight of the frontline staff.
So how do you track a case? When a phone call is made, how do you know, Mr. Ellis, that it has been completed? So how do you know that the caseworker responded, the supervisor followed up, the manager did their part, then I guess you would be next, right? So you the assistant, and then Mr. Ellis, how do you know that the case is completed?
Well, my oversight actually comes from what I get from Ms. Broussard. But
Okay.
basically, when an intake is called in and it's assigned to the local office, a supervisor actually is the person that's working what we call the queue. So that case is assigned to a worker and a supervisor to investigate.
So two people are referred.
Not necessarily two people are going out, but the supervisor is providing oversight to that worker.
At the same time?
Yes.
Okay, so they receive the information at the same time, but the caseworker is responsible for going out, but the supervisor know what's going on.
The supervisor actually is the one who's making the assignment
Okay,
to the worker.
okay,
And then they're working along with that worker to collect the information based on what that allegation is.
okay.
And so it's a didactic relationship. They're constantly in touch with that worker as far as what they're seeing, and the worker's getting guidance. And as you heard before, many of our staff are less than 18 months, and so it's very critical that that worker and supervisor have that line of
So
communication.
caseworkers and supervisors and managers are less than 18
No,
months?
managers have probably a longer tenure
Okay.
than our supervisor. I would say in Baton Rouge, that's probably been about 5 or 6. Well, maybe I'm backing up. It's probably 3 or 4 years at the manager's level, and maybe 2 years or more at supervisor's level.
How many years for supervisors? So that's only 6 months more, right?
And if I can add, hi, I'm Mona Michelli,
Hey,
Deputy
Mona.
Assistant Secretary. And part of that, too, the difficulty is that we're also having supervisors who have less experience who are promoting a whole lot sooner than they would have ever promoted normally because of the staff turnover. We also have, because of the staff turnover, we have supervisors and managers who are also working cases. We don't have the luxury of just assigning the cases to workers right now because of the short staff and the turnover.
How many caseworkers do you have in Baton Rouge?
We have, as far as the caseworkers, do you have-
Our frontline caseworkers, I can answer that question. We consider frontline to be our CPS workers, who are first responders when we get a call. Our family services workers, those are our families that we've identified as needs some additional services to help prevent maybe that child going into foster care, or to really provide services to make sure that child is safe, not at risk of future maltreatment. We also have our foster care staff when children are taken into custody. And so those are our 3 primary, what we call our frontline staff. And so for frontline, I have roughly 29 workers that are able to take full caseloads.
So when you say take full caseload, what qualifies them to take full caseloads?
Finish completing training and being, 6 months after being hired, they're able to take a full caseload. So we gradually move up to progressively moving them to a full caseload.
So you have about 29 people roughly. You got 3 different categories. How many do you?
And I'm sorry, I don't want to misspeak.
Okay.
So we have 60 positions, and of those, 29 are vacant. I'm
Say
sorry.
that again?
We have 60 positions for our front line,
You say 60 or 16?
60 for
Okay.
those 3 programs.
of
And
which
29 are
29.
vacant?
Yes, ma'am.
So you actually have 30.
30.
31.
And then to compound that, you have the vacancies in support staff, transportation workers, so that the result is that the workers are having to do that level of work too. They can't rely on having a transportation worker assist them in bringing a child to a doctor or
So then that means they have to bring them?
Yes, ma'am.
yes, to therapy, to drug screens, to medical appointments, to school meetings. That falls onto the workers.
On average, how many cases do these frontline workers have?
Okay. So I'm gonna just take the month of July for because it just ended. We're able to look at that data. For CPS workers, we received 180 new CPS cases, meaning that we need to go out and investigate. Best practice is that we provide staff with no more than 10 CPS cases so that they can adequately assess families and provide services. To be able to meet the 10 caseload maximum, I would need 18 CPS workers. I have 7 that can take full caseloads.
So you don't even have 10, because I was going to say that based upon my math, I would kind of split it into 3, since it's 3 different categories, that you would have 10, but you only have 7.
I'm only talking about CPS.
Yeah. So, and their caseload on average, because you just said 189, so
80.
180.
Yes, ma'am. And that was
Divided into
last
7,
month.
right?
Just last month.
And that's a light month for us. School is
What's
about-
the average? She said, I think it's 10 to 12. What did you say?
for them to get cases per caseworker.
Uh-huh.
We would like it to be at 10 a month for them to be able to adequately do their work with the families. And July was a light month because school is out of session.
July was a light month.
Yes,
Yeah,
ma'am.
with school beginning today, we expect our intakes to come in.
We have a big problem. So let me ask this question then. I've heard, and I've been in settings where, with National Conference of State Legislators, where this is a problem not just unique to Louisiana, it's a national problem. But it seems like we are on an elevated schedule, or it seems like it's really elevated. I mean, I'm concerned, and I want to know what's going to happen that's going to be different, because if not, we're not going to have any different results. And what we had happen with the baby is so unacceptable, guys. We can't have that.
We agree. And just like before us, Mr. Summers stated, at the heart of everything is staffing. Having not just the number of staff, but qualified staff with experience who can deal with, from the substance exposed newborns, like we talked about a few minutes ago, to the 18-year-olds, and every issue that comes in between for all of those children. We are having hiring fairs. We pulled staff across the state just last week to interview over 51 candidates. We are doing that. We are offering overtime. We are offering incentive pay. We are also bringing in additional staff throughout the state, a team of staff, to be able to assist Baton Rouge with investigating, because that's at the point where we're at. We are looking at any kind of possibility that there is to assist Baton Rouge and then to meet the needs of our clients. We are also assigning cases outside of Baton Rouge in Livingston Parish because we don't have the staff in Baton Rouge. We are having staff from Lafayette complete foster care visits for us. It's at that point. We are not in a good situation.
So how do y'all plan to fix it, I guess? I mean, I heard about what you're doing or trying to do, but is it working?
Well, these are things that we're just starting. I think to fix it, we are going to need additional staff. I mean, just like our counterparts before us, I mean, it's been very, very difficult to attract individuals to do this work. I mean, I've been doing this for 35 years. And so we just don't have that type of commitment anymore. I mean, most of my colleagues that are sitting in here have been here for a long period of time because this is something that we had a passion to do. We don't see that in the employees that are coming or the potential employees that come to us now. They don't want to do this type of work.
Especially for $36,000.
Right.
If I can go work somewhere else, and when I leave work, right, my job stays there. I don't have to worry about going back out, being on call, picking someone up. I mean, I can see that, and especially with the younger generation.
And I can give you an example. I was at the office Baton Rouge last week, and for Tasia and Anthony can tell you, at any given moment, 7 o'clock last week p.m., the office parking lot is still full of staff. You know, there's children still in the office who are being moved, or they're bringing to different places. The workers are actively working on investigations. They don't quit, but they're tired. And you know, until we get more people, supervisors are having to work cases. They're not able to provide the attention to the workers. That is the ideal situation. It just affects all up and down. You know, it affects our staff and it affects our clients.
I think I'm gonna stop right there. Well, yeah, I'll come back. Let me go to Representative Freiberg. You have something?
Yes, ma'am. I had some questions, Madam Chair.
Okay. Well, let me
Okay.
yeah, hold on for
Let
a
the
second.
senator go first.
First of all, thank you both, and I want to thank you for the work you do. I'll give you one quick example I saw. I was at the grocery store this weekend. My wife gave me a big old list of stuff, so I'd keep going down the same aisle over and over looking for the same thing. And the poor gentleman that was checking me out, he was almost falling asleep standing up. So I asked the young man, I said, "Are you okay?" He said, I'm working, this is my third shift today. It was about late that evening. I said, "What's the problem?" He said, "You would be surprised how few people are working at this grocery store today." And I said, "What happened?" He said, "We interviewed 4 people. They all accepted the job. Not one of them showed up for training." Mm-hmm. And it's systematic everywhere in private business. But what I want to thank you for, Madam Secretary and Chip and your team, is we just to give everybody a brief kind of backdrop, as the chairwoman talked about and as the secretary talked about, it's breaking everybody's heart. So I think everybody wants to do something. Everybody feels that, we have to have a hearing, we need information. So I received a call from the pro tem, and she basically said, "Let's have a joint oversight hearing immediately with Health and Welfare." So my instinct was, well, let's get more statistical information to the committee members so that when we do all meet, we understand statistically what's going on. But I just wanted to lay out some of the things I'm seeing that I've had a chance to look at statistically that you guys are facing. And in the attrition rate report that I saw, what's amazing is year after year after year, 5-7% has maybe been the statistic of people that are leaving because of pay. But when you look at the attrition rate, when you must do an exit interview, just this year alone, I think you're at about 60% of just personal reasons, the job, just the stress. So when you look at the regional averages, Louisiana seems like it's okay on the pay level. But the dissatisfaction that you having to deal with as an agency is, percentage-wise, people either burn out, they don't like the job. When they entered it, they realized it probably wasn't what they wanted to do. So your attrition rate is extremely high. Now, I know we'll probably all have a talk about it, but I just wanted the public or anybody to see this. We asked kind of some detailed questions in it, and so you were able to provide us, here's just a small smidget of the policies that you have to live with.
Yes.
And I will tell you, between the attrition rate and the training, you're trying to drink a sip of water out of a fire hose. And so I think we're going to probably have more discussions, because as elected officials, we want to get to the answer and you want to get to the answer. But I just wanted to bring out for everybody to understand that I bet if you look at just the policies, how intricate they are, and the training that's necessary and adherence to policy, you probably, as leaders, are staying up at night just wondering if your people can intake all this information.
Yes.
Because it's
Yes.
got to be a situation where if I had to adhere to all these policies and procedures and everything that you're doing, with attrition, and I'm repeating myself now, but with attrition and with probably early retirements, it becomes even more of a challenge, and the volume of calls that you're getting. So I just laid this on the table, Madam Chairwoman, because I think there'll be a detailed series of discussions, And as the secretary said, I saw where her heart is absolutely broken, and all of us have that same feeling. But I really don't have a lot of questions today. I'm absorbing all the information that came in. But I think as legislators, we're going to all need to see the hardcore statistical facts that are coming in, because it seems like, and I guess I will ask this, is it seems like from 2018 to 2022, in the questions that you answer statistically, it looks like it's getting more and more grave of retention and attrition. Because I'll just go through this one table that the department was able to provide for me. In 2022, a child welfare specialist trainee, the attrition is 68%. In 2018, the attrition was 25%. Now, y'all heard that? I mean, 25% was the attrition rate in 18. Right now, it's almost at 68%.
Yeah.
It's like statistically, it's like it's hard for me to formulate the right questions to answer, because if you don't have proper staffing, retention, training, and your policies and procedures are so intricate, it seems like it's going to have to be a more lengthy discussion. But am I hitting those points correctly?
Yes, yes, you are.
So,
Yes. Couldn't have said it better. I mean, everything that you're saying, this is what we're living, this is what we're seeing every single day, and it keeps us all up at night of what can we do? I mean, there is not probably a day that doesn't go by that Dr. Hodnett and myself are not talking on the phone about what's next. What else can we do? How can we support our staff? How can we address this issue? It is a constant attempt.
and I don't. I think I just want to learn more statistically and learn more. And, I guess what I would say, because Senator Barrow and I had some lengthy discussions on this, is, yes, we probably will need a health and welfare committee to talk it through. But before we do that, I'd like to get this statistical information to the committee members, because they will want it. But I guess I would just conclude on this note. It seems like more, and I'm just throwing this out there because it's not a solution, but it seems like more and more industries are having to go into more, what can I automate? What technology can I invest in so that maybe I don't have to invest as much in people, which this is a people business.
It is.
Right.
But what I guess I'm saying is, from a technology standpoint, it just seems that, I think the secretary started off in her discussions that some of the systems are antiquated, some of the systems are not talking to each other. It just seems that automation in some aspects will have to help the future of the problems that will continue to materialize.
Right.
So today, Madam Chairwoman, I don't have a ton of questions to drill into because there's so much information to absorb. I guess I would ask this one question and turn it over to the rest of you. If you had to get a full audit on your policies and procedures, and I'm not suggesting any of this, but if you were audited on policies and procedures, I would bet, and I don't want to put words in your mouth, that it's tough to adhere to all of these procedures with such attrition and such new people in the system that even the policies and procedures aren't fully adhered to.
Yes, they may be solid, the policies may be solid, but the practice around the policies just cannot be complied with 100% because of the staffing situation that we're in.
And that has to be giving you the sleepless nights. That
Yes.
here's a policy, and I'm telling people I'm adhering to this policy, but I can't adhere to this policy because of the myriad of attrition, early retirement, retention, and the whole skit.
Correct. And there's certain pieces of the policy that are guidance and certain pieces that are requirements, but it is definitely difficult to achieve all of it right now with the staffing issues that we're facing.
Well, thank you for your honesty, and thank you, Madam Chair.
Thank you so much, Mr. Chairman, and those were really great questions. It did make me think of one other question that I wanted to ask, and I'm not sure who may be the best person to answer it, but I know a couple of months ago during joint budget, we approved for this new system. And so I think it's supposed to go live, if I remember correctly, at the first of the year. No? Before? Longer? Because I want to know how that's going to help with this process? Will this help us? And it's my understanding when you guys came that this would be something where everybody can see it at the same time, what's happening and where it is in the process. Am I right?
What, in a perfect world, we would have a system where you could click on a child's name, like Mitchell. You could click on his name and you would see his entire case history, every intervention or touch point that we had had with him. We have 5 different technology systems. Most of them are 30-something years old. They do not speak to each other. And so you can't get that kind of data out of that. That's why when I say it takes us long to do an investigation, we're not trying to sidestep anything. We're not trying to hide anything. You know us. We are very transparent in the good and the bad and the ugly. But we have to pull it from so many different systems, and then you have to cross-check and see, is it the right name, and could the name be spelled differently, and what's the date of birth, and does that match a social security number? And it doesn't match, and so then you go back and you hand pull, and we have staff to go get hand pull data
Wait,
to
hold
see
up.
if they
You
can
get
find it.
staff. Please tell me it's not the caseworkers.
No, we're not.
Okay.
We're pulling the state office staff that are doing it. That's the 3 data people that we have. But they have to talk to the frontline worker to ask them, is this the right one? So the short answer would be we would have a system that would give us all of that. We don't have that yet. It is being built. I've got Dr. Horan and Carla Venkataraman, who have been working the most closely with the CWIS build, if you want to get into real specifics about that.
No, I just want to see, when is it going to go live?
Not until 24. And then we will have to train on it. Yes, it will go live in 24.
Yeah.
That is not as soon as we had hoped. That is not, we really believed we would walk out the door with the system in place, but I do not believe it will be ready, and I don't want to set a false expectation that
Okay.
it will be ready.
All right. Senator Jackson?
Yeah, I'm sorry. I'm like, put me on.
You
We
on?
talked about this in joint budget,
Yes, ma'am.
and we approved an extension. My understanding is we hired a private company to do this. I remember them coming to the table. Right? And I think all of this is DCFS staff. So you don't have this contract. You're not being paid for this contract. And I've said this in joint budget when they asked for the extension. I said the longer we extend this vital part of taking care of our children, is the longer we're going to have these things that slip through the crack that cost lives and impact children. And so I really don't have to discuss this contract with you because you're not being paid for this.
Right.
There's an outside vendor, and that's where I am with this. That's being paid for this. Non-Louisiana company. I guess we didn't have the expertise here in Louisiana. But so I'm going to reserve my questions on the contract, and if you want to turn me off, because I do have some other questions. But the truth is, this is not a DCFS question on this January 2024.
No, I thought it was going live. I was hoping anyway that it was going live next year.
No, remember when they did that extension in joint
Now,
budget?
now I do remember.
And so, but I am going to ask some questions if Madam Chairperson will allow me, or you may want to finish with something else besides the contract.
No, I'm finished. Did you have something, Mr. Chairman, on the contract? No. Okay, so you guys may have to do musical chairs all over
That's okay.
again.
I mean, look, there's no need for me to beat you over the head about that. The state contracted through a bid process with a private company who asked for an extension. That extension is costing lives. That's the bottom line. They may not like what I say, but it's just the truth. We've talked about that. We've known this system was needed when we originally approved this. And how much are they being paid for this?
It was the original contract. I'm sorry, Eric Horrent,
Come on,
Undersecretary at DCFS.
Hate leaning.
The original contract was 13 million, and I think it's adding 11 million.
When we did this contract, what was the estimated completion date?
The very first one,
Yes, the very
Yes.
first one.
15
Being
months.
realistic, the very first one where we're paying
Very
$13
first
million
one
for results.
was 15 months.
Which should have been completed by when? I'm sorry.
No, baby, you go ahead. You're the chairman.
Because see, now you don't stir me
Yeah,
up.
go
'Cause
ahead.
'cause
See, that's what I'm saying. We
that
tag
could be
team
another
all the
issue.
time. It doesn't matter.
I think it started around January 2020. So I mean, you had 20 months. I mean, 15 months. to
15
that.
months. So it should have been finished
Mid 2021.
mid 2021. Yeah.
I mean, it's a very tight deadline. We discussed that at JLCB. That's a very, very tight deadline. For
Let me say this to you. When a private company comes in and takes $13 million of the state's money, I can understand an extension reasonably. But you're extending a $13 million contract by,
2.5 years.
yeah. Is that 2.5?
Yeah, 24,
My head's
right?
hurting now.
No, it's
And
2 years.
members,
From
you do-
2020, right?
Yeah.
But
From 2020.
Should have been
2 years.
mid
It should have been
2021.
finished by 2021.
Mid 2021.
Correct?
Yeah.
So that's about 2.5 years. More.
Yeah.
That's too long. We should
and
not
members,
approve
you
that.
have to
And
remember
don't
that
bid
it
with
was
the state.
COVID.
Well,
And so they were not able to be on site and do a lot of the work. So COVID did have an impact on that. I'm not giving
well,
them.
if the building was shut down, right? Your workers were working from home.
They were working remotely, but there's a lot of back and forth between staff when you're building a system that staff have to be Carla's the expert here. I don't need to be saying
I
this.
understand. So we gave them that extension. I think it was because of COVID. Thank you, Madam Secretary. But that's not you. And we need to be asking to move this forward.
Right.
Yes.
And I'm going to have some questions for Madam Secretary, but I want the Baton Rouge office. Because I understand, I used to work in state government, that every thing doesn't make it up to your desk. So me asking you questions or holding you accountable for something that's not at your desk, I know the buck stops with you, but the factual segment of what's happening. How many times had this child been in a hospital for overdose? Not gonna be able to give that?
No, Senator, we can't speak on specifics of this
Okay,
case.
so let me say this. When a child, let's talk about procedure. When a child presents to a hospital with an overdose, I think you defined it. Is it level 1, P1? What is it?
What are the categories?
You have the categories.
They're called priorities, and we have
Those
1
are
through 4.
1 through 4.
And that determines our response time. How
So can you tell us what P1 is, what think P1, P2, P3, P4?
Okay. I can. Let me take that. So whenever a call comes into centralized intake, whenever it's accepted, part of that screening process is using a screening tool to determine what the response priority is. The P1 is a priority one, which requires a 24-hour response.
Tell me what response means when you say 24-hour response.
So response means making contact with the victims, initial contact with the victims, and at least one of the parents.
Is that making contact via phone or in person?
In person, face to
In-person
face.
contact. Okay. Keep moving. We can keep moving.
So the P2, a priority level 2, is 48 hours.
What fits into those categories? What type of case? So what would be in case 1?
Priority 3 and 4, Madam Chairperson.
Yeah, I can share with you the screening tool that we use and how it
Okay.
determines it, but it's based on our safety model and threats of danger.
Gotcha.
So the threats that are presenting itself at that time.
P3 is how much time?
P3 is 3 business days,
3 business days. And P4?
is 5 business days.
Okay. Now, a child who presents, no particular case, a toddler who presents to the hospital with drugs in his or her system, what would that rate on the P1 through P4?
I could not say, I would have to go through that tool and that screening tool to be able to tell you.
So,
It is
so you're
every
telling me that it's
situation
possible
is
for a
different.
child who presents at a hospital, a toddler, with drugs in his or her system may rate a P4?
I would not think that it would,
Yeah, me
but I
neither.
do not want to say
I understand
specifically
what
with
you're
a case.
Right. Because then we
without-
have a problem with procedures. Because I really believe that a child who shows up with drugs in his or her system, illegal drugs, at a hospital,
Yeah,
automatically P1. I think that if our procedure is not that, it should be that. That is a P1. You need no expertise to know if a child presents at a hospital. And if the state's procedures are otherwise,
right.
it's a P1?
Yes.
Because let me just, because I'm like, so let's not play with procedure. Let's say P1. Who's responsible at that point for contacting that child, with that child's parents are making contact within 24 hours?
The investigator, the CPS investigator.
Okay, and that's in your department.
Yes, that's at the local office level.
And that's going to be the Baton Rouge, well, we're not talking about a specific case. If it happened in Baton Rouge, that's the Baton Rouge office. But I'm going to say this. Madam Secretary has a lot of reasons, and so do you in this department, for things that are happening that are beyond your control. A child with drugs in his or her system as a toddler not having some contact within 24 hours, no excuse. Zero. That's why we have priority levels. A child presenting to a hospital, let's say hypothetically, twice with drugs in their system. It's horrific that we would miss it once. It's inexcusable, and I know that you guys weren't assigned any case that we may or may not be talking about, that we miss it again. It's almost criminal for whoever has that case. It is to me that they missed it third time.
I agree.
And so I don't want anything past what I'm going to say to not address the elephant in the room. And that's how I'm going to address it generally. So anything we talk about to help Madam Secretary, and we've talked about and recognized as issues with the department that are beyond her control or your control, that type of case doesn't fit into that. Because I don't want anyone leaving here anywhere thinking that this committee believes that a P1 situation in that fact scenario has any justification. It doesn't. So I am, as I always do, Madam Secretary, I'm going to sound the alarm regarding what you have been dealing with, because that's factual and that is true, what all of you have been dealing with. And nobody sitting in this room hopefully had a case of that scenario, because they should be gone.
Yep.
And we
Even
understand,
be a state employee. And I know you can't speak to it, but I'm speaking to it.
and we
under that,
understand
yeah.
and share your concern about every child that we serve.
Right, but we're just these particular type of incidents. And then there's another case that I won't speak particularly to. I'm going to speak to the fact scenario, because we had it last year. Remember, we had a case last year. And then my sister senator is sitting with a case in her district regarding child molestation. Now, let me get the specifics on not that case, but just a generalization statement. That's at some point after the second, third call P1 to me. That is an urgent matter. And regardless of what else we have going on in our worlds, our departments, or what is happening, it becomes inexcusable. And I know that I'm hoping I'm not talking to anyone in a room that had a case where that happened, because I would be honest with you, and this is not judgmental, this is factual. It's inexcusable. And when that happens under someone's watch, because I know it's one caseworker who has this case or that case, they just shouldn't be working for us. Maybe they're too burnt out. Maybe it wasn't intentional. But the truth of the matter is, it's real. It's caused lives and devastation to young people. And this is just no longer the field for you in the state of Louisiana with DCFS. Because I want to talk about the problems, but I want to really state that. For the family members who are walking through this, who suffered from this, from the kids who are going to be traumatized from sexual abuse because something on this magnitude was just, this is not a slip through the crack. This is not a heavy caseload. These type of things are negligence at its finest.
And that doesn't speak to the people who didn't work the case. But that should be placed on the record, I believe, Madam Chairperson. And I know I'm in your district, but that is just negligence.
Thank you, Senator Jackson.
I do have
I agree.
questions. I do have questions.
I agree.
Now, I understand, Madam Chairperson, Madam Secretary, in the Baton Rouge office, Monroe office, every office, you've lost 500 employees. How many have, and I know you're probably gonna have to come back to the table for this, and thank you, Baton Rouge office, I got in my sister senator's business a little bit, because I've seen it across the state, and I know this is not you as supervisors. And those comments were not reflective of your workload or what you do, but of people who just became very negligent and derelict in their duties to those children,
We
period.
understand, and thank you.
Yes. And you want to come back up?
Ms. Broussard, please stay.
Now, I do want to deal with the issues of this not happening again. I think we've dealt with the contract, and Madam Secretary, I know your heart. I've had online and offline conversations with you. How many people from those 500, how many TOs, I call them TOs, you know, I think budget TOs, you were reduced by 500 at some point. Am I correct?
Yes, during the general years, yes.
And when you're reduced by TOs, that means you cannot hire regardless of your need.
Correct.
And I want the general public to understand that, because it took me a while working for former Representative Hunter to understand what the gist of a TO was in a state budget. That's the number of employees that a department can hire. And when that budget passes, absent a BA7 or something happening during the year, you are restricted to that number. So when you lost 500, you lost 500 people.
People, yes, ma'am.
Okay. How many have you been able to regain?
The only additional staff that we have added are additional staff that we have added for new bodies of work. Like when we raised the age of foster care,
Right.
we got staff to do that. We just added more staff in this last session because we raised the age a few years ago and we added staff then. We just got more because we've had so much success with the extended foster care program that to keep fidelity to the model, we had to hire more people. So we got those. We got the Wendy's Wonderful Kids Recruiters when we started that program. When we got charged from the federal government for doing a state central registry, we got staff to do that. So every time we've started a new program, we have gotten the staff to do that new program. None of that was put to the 500 loss.
So your TO increase is only attributed over the last, 6-7 years to new programs or new mandates that came down.
Yes, ma'am. And we did have, just to be clear on the record, we did have additional staff on the other side of the house that was added as well. So if you just looked at the raw number, you would see more than that, because we have had staff added in the disability determination when we got new work from the feds. That gave us 40 staff there, I believe. And then when we brought the workforce program from the Workforce Commission back to us, we got another 40 staff there.
That was taking on new duties.
Right. That was
But
all
nothing,
over,
let's
right.
say the Baton Rouge office is here today.
Yeah.
Their
Correct.
TO as far as priority 1, 2, 3, 4, nothing has been added.
No, ma'am.
Traditionally, the caseload for a caseworker is how many? Like the ideal caseload?
10 new cases of child abuse investigation and 10 children in a foster care caseload.
And that would make the total caseload.
That would be 2 different staff. The child abuse investigators would have 10 new cases every month. So they would have some that they would be closing, some that would be in various stages that they're bringing forward from previous months. But in that new month, that single month, they would only get 10 new ones.
Okay. And how many are you getting? Is it 17 or something?
Our current caseload, FAB, is 30 cases each.
Well, in foster care, our staff have roughly between 20 to 30 cases of, and that's just the children. So that's not the families that we're here to support and try to reunify their children with. And that's also not the foster providers and all the other, courts and everything else. So when we say children, we're just talking about the child and not everyone we serve that's connected to that child. Looking at CPS, ideally it would be 10. But my CPS workers who we would consider experienced, the ones where we said roughly have about 18 months of worth of experience if we go across our,
That's why they're not staying.
Well, and that is part, that's,
I think we need to get to the crust of it. Madam Secretary was here before session. And you said that your caseworkers work all day
yes,
and there's no night crew.
Correct.
So P1 comes in at 7 p.m. They have 7 p.m. the next day to get it done. There's nobody there in the evening, so it's only that caseworker that it's assigned to. We talked about Texas. You remember that?
Yes.
And we said Texas has had a more successful model because they've changed to having a day crew and a night crew. And they have caseworkers at night. So
And we do have workers at night that are on call, let me be clear. So there is somebody working 24/7, but it's an on-call rotation.
but do they work in the daytime too?
yes.
Yes,
Yeah, so it's
Yes.
not you just have the same person working.
Correct.
that's right.
It's a burnout.
That's right.
18 months of working for how much was it, Senator?
$36,000.
$36,000. I'm fresh out of college. $36,000. I have to work all day, and I'm on call. Doctors are on call, but they get paid for it.
That's right.
Nurses are on call, but when they're on call, they get paid for it. Judges are on call every once in a while, but they make $160,000 plus a year. I don't know a job that's on call like that, starting at $36,000 a year for a recent college grad. I don't. And I'm not judging you. You've been sounding the alarm. And I'm not making an excuse for you. That's why I wanted to get out on these cases first, that what happened was inexcusable. Whoever had them assigned, I'm saying it, shouting from the mountaintop, they should no longer be with us. There may be procedures, but I should just know we have a procedure in place for immediate termination or something like that. And when we pass that, the bottom line is, I'm going to see you again here because the legislature has not answered your call. And I think that we have to share in the burden of that. 3 separate branches of government: executive, judicial, and legislative. And we love to call people before us. And I ask you to be here. I actually said, Madam Secretary, please send her an official request. Because I think when something like this happens, we have to.
Yes, ma'am.
But I want to be very fair in what we're doing. And I said this to OJJ. You were here. You understood what it stripped you. You understood the need. The people that are sitting with you probably have a better attrition rate than anybody because they're here and they care, right? But the bottom line is you've worked through this. I don't understand how we lose 500 people while caseloads continue to increase and we never begin to feed back into your department.
Thank you, Senator. Neither do I.
Yeah. But the truth is, it's not about you, it's not about me, it's not about Senator Barrow, it's not about Senator Mills. We sleep at night and we're comfortable. And our houses don't have the problem that these kids see. And we don't have children in our houses that are being abused and, molested and things like that. But there are children out there that depend on this department. That's problematic for me. I think we can sum up what's happening in certain cases. Not in these, I'm gonna be honest, not in these. But it's close to that because you're holding on to every employee you can get. Even, the employees that, and look, during COVID, we all did it. But we weren't taking care of children like you are, where you just kept the employee even if they were giving you 50% of the work. And I see private businesses doing it now. They're keeping that employee because they cannot find, I think some came out in CNN that there was a $60,000 great resignation across the United States of people who resigned last month from jobs. And we're all in private business. Sometimes we're keeping people that do 60% of the work, 75% of the work because we need the work done, even if it's not at the level and capacity that we need. because we're all trying to survive in business. But the bottom line is your business is children. And there should never be a time that Louisiana has any department whose business is the protection of children where you got to beg. And that's my problem. And I understand what you're facing. You came in here before session and said, if I could get something like the Texas model, I could handle this. Remember that testimony?
Yes, ma'am.
And not one piece of legislation came up because it required a budget. It required a budget increase. It required adding back to your TO so that you could develop that model. And I've seen a lot of comments, and I've told you I'm angry about the two things that happened. Mm-hmm. Because those are just on someone who, if they were experiencing burnout, they should have said something. But in my heart, I couldn't have worked in your department and saw that and not answered the call. Period. And I don't think you would have. I don't think the supervisors from Baton Rouge would have. I think if they had to go out at 11 o'clock at night to meet that 48-hour requirement for that child that was in the hospital, they would have. So that's something a little different. And I'm very serious about that. But this is not about us because we stay in safe homes. This is about the children that don't. And I think it's incumbent upon the executive branch to submit a budget that makes our children whole. I think it's incumbent upon the legislative branch to receive that budget and understand the need for it. So it's on all of us on that. What's happening in this department, we are turning somewhat of a blind eye to. We're screaming, and we're prioritizing money past the children. And I know nobody in the legislature is going to be happy with me saying that, but at some point, it needs to be said, and it needs to be real. And we need to be about funding your department.
Thank you.
Because we're funding children when we fund you. These state workers are not just heads that we pay or big budgets that we inflate. This is about making sure a child that was molested one time is not molested 2 or 3 other times before somebody gets it. Or a child that's had an overdose of drugs doesn't go to the hospital for 3 or 4 times before he or she dies, or someone recognizes that something happened and that child has permanent. This is about something way bigger than most of the legislation we deal with.
I agree.
And so I don't excuse at all what happened, because that is not a budget issue. That's just the heart of the matter. But I understand that you're struggling to keep retention. I understand that. And that you can't say, I'm going to keep the best and the brightest, because at some places you wouldn't have hardly anything right now. You know, and I think somebody's cameras tell me I'm done. But, and I'm saying this passionately because we were here with, I forgot what name we put in the record for the young lady.
The last case.
And we had those 2 ladies, young ladies, and one was taken out of the home and one remained in the home for 9 years. Was it 7 or 9 years?
Something like that. You know who we're talking about.
Yes, I do. Mm-hmm. And we did pass legislation, just to be sure, Senator Jackson, that we did, Senator Mizell had a significant human trafficking piece of legislation that was passed this past session that did add money that will go to direct services to victims.
Human trafficking victims.
Yes, human trafficking victims. So I don't want to.
Right, we did. I think it was like $3 million or something. Yes. Now, does that go to hire?
That is not staffing for DCFS. That is money that will go to victim services directly to the clients.
So we still haven't resolved the financial budget of having enough staff when these complaints come in.
Correct.
Yeah. I'm done, Madam Chairperson, but you know it's the same spiel every time we come. We know what's happening.
Senator Jackson, if I may, I just wanted to thank you for your comments. I also just wanted to reserve just to make sure that since we're not talking about specific cases, and I know that just as we are alarmed and we're trying to figure out exactly what happened in both of those cases because we're in review, I just wanted to state that we don't exactly know everything that happened in both of those cases, and either way, it is unacceptable. But I just wanted to make that statement that we're still uncovering exactly what happened to be able to take whatever steps we need to take. And so I just wanted to
Now,
acknowledge
I understand you're not a private business, you're a State Department, and there's a procedure.
that. Yeah. Yes,
And
ma'am.
I
Thank
respect
you.
that procedure. That's why I reserved my comments to only me and what I felt
Yes, ma'am. Thank
about
you.
what was going on. I'm not going to ask you anything about it, but it's just my personal opinion.
Yes, ma'am. Thank you.
That's, it's what it is.
Okay, thank you, Senator Jackson. Representative Freiberg?
Thank you, Madam Chair. I will piggyback some on what Senator Jackson has said, and I specifically am looking at the cases in this area because it affects me just as it does Senator Barrow. I think in the last few years, some horrific things have happened to children. I've been tempted to write them down because they've been so horrific. Not all of them have gone to your department, but many of them have. And one of the recurring themes is they had been reported 3 or 4 times. Nothing had ever been done. People had gone out, caseworkers had gone out, but nothing had been done. And so these cases are not a case of not having enough staff. It's not a case of not knowing, as in the most recent case, some of the information about how that drug might affect. But I don't know if it's systems not talking to each other. How can a caseworker go out, and I assume the same caseworker deals with the same families. How can that caseworker go out 3 or 4 times and nothing be done?
So let me just start by saying that you're not always going to have the same caseworker going out again and again on different cases. So I think, there are some assumptions that when we do have turnover, what we didn't talk about is if I were a caseworker that got 15 cases this month and my next door neighbor suite mate left because she decided enough was enough, then her cases will then be shared among people, and we don't even usually count those cases in the case count that they're picking up. And so a person may actually have more than the initial cases that's coming out.
But the paperwork doesn't follow
The paperwork
to the new
will follow.
caseworker.
Yes.
It doesn't seem to me this is a problem of systems not talking to each other. It doesn't appear to me that this is a case of not having people, because people are there. People have gone out to these homes and they've observed things, and yet the child gets returned to the home. And I know that's what you want to do. I know that's what our goal is. But when a child dies, that's horrific. And when we have seen a situation where a caseworker has gone out many times and then the child ends up dying, I mean, how does that happen?
Yes, ma'am. I think we would have to look at each case to talk about what happened in that case to be able to.
So there's
answer
nothing in
that
general
specific-
that has been characteristic of these cases, because I'm not just referring to the most recent one. I'm referring to the past 2 or 3 years.
Yes, ma'am. So we certainly would be able to bring up the child welfare staff again to talk about the changes that we've made based on the things that we've learned over the past. We do case reviews to make changes. We do that. And so we would be able to talk about what we've put into place in the last couple of years, or even most recently, to characterize what you call, like, what have we learned overall and what have we done in addition to that. We can talk about that if you'd like. Would you like me to have the child
I
welfare
would.
staff
I
come
want
up?
to ask another question before they come up, though. In the case in Zachary, okay, and I'm not going to do specifics or anything like that, even if there had been no abuse whatsoever, when you see the pictures of the environment that these children were allowed to be fostered in, how can a caseworker say it's okay for a child to go back to that environment.
Representative Freeburg, we can't speak to any cases in particular.
But environments in
certainly
general.
Environments do matter. And your question generally about looking at a home to determine its sufficiency is the right question. It is a question that we ask. So as we look at every case, we would review what was the matter, what was the situation at the moment that that house was entered. And we would have to look at every case specifically, and we wouldn't be able to talk about that one.
Okay, if on a high level, the folks from this region could answer any of my questions about what they've learned, how they've improved things, because it seems to me we're making the same mistakes again and again.
Thank you, Representative Freeburg. And so we'll have the child welfare staff come up.
And again, like Senator Jackson, I'm not trying to put the blame on anyone. It just seems to me people aren't doing their jobs, and how are we correcting that?
I certainly can see how it appears that way. I will tell you that substance abuse is one of the biggest factors in the cases that we deal with. I would easily say upward of 90% of our cases involve substance abuse, parental substance abuse. And many times, our goal is always to help families, to get families into treatment, to try to rehabilitate families. Many times, we're successful short term. Things improve, things change some. And the last thing we want to do is to tear a family apart unnecessarily. Of course, we want children to be safe. And if we can help the family to maintain the children in the home safely, that's what we're trying to do. And so putting in services, we have other services like the home builders model, for instance, which is intensive in-home services, where someone is in there 15 hours a week for a period of time, really observing what's going on. So many times families make progress, and they make progress for a period of time, and then things change. And so that is partly what happens. The other part of it, I would say, is that we do not have the authority to remove children. That comes through a court order, and so we partner with the court as a sort of oversight, a double check. We provide information, and then the court either validates that this information is sufficient to remove the child or not.
Do you have any ballpark figure about what % of your cases do end up going to being referred to a court?
Well, so just this year, in just Baton Rouge, 155 children came into foster care, and those all would be through the court. The other big piece when we talk about ways to make improvements is the partnership between law enforcement and child welfare. We really need to strengthen that partnership. We do have good relationships. You all know how stretched law enforcement is as well, though. And so there are memorandums of understanding between law enforcement entities and our local offices about how they will partner. We would like to strengthen those substantially. And this concept of a team, a child protection team that goes out, that really would be the best practice. Our staff are they are investigators, but they are assessing. They are not criminal type investigators, and so that partnership with law enforcement is critical to make sure that we are understanding some of the nuances of investigation and the criminal elements of it. Yeah. And that really is a piece where I think we could see some improvement. The other part is the having partners that have a depth of understanding of adult substance abuse and addiction. When we have substance-exposed newborns, those cases have continued to rise year after year after year since we began tracking it in 2007. And to remove an infant from their mother is not a thing to be taken lightly. Yet to leave an infant who's not safe, who is the most vulnerable of the children that we assess, is not something to be taken lightly either. And we are called to make that decision pretty quickly. And we have tried for years to partner with substance abuse professionals that really understand what are you looking for, what are you trying to hear, what are you trying to see, because they will tell you that they will minimize completely the situation. And you hear a lot of, it's only marijuana. Well, we know that marijuana is responsible sometimes for many of these rollover deaths where babies are rode over on as they're sleeping. And so it's not only marijuana, and yet we can't foresee all of these things. We have risk assessments. We have an extensive safety assessment that we've worked with national partners. We have had our policies reviewed as much as very recently, and what has come back is that your policies are solid, but they're not. We're dealing with humans.
Gotcha. Thank you.
I wish I had a better answer for you because I share your frustration.
Thank you, Senator.
Thank you, Representative Frybird. Greatly appreciate it. As we are beginning to wrap up this section of the session, I do want to make some final comments myself. And so certainly I understand the scope of the work that you guys do, because prior to me working here, I worked for a counselor who actually saw children from DCFS. And so I have that whole perspective, that whole view, and things have changed a lot since that time. The level of cases that you guys have to deal with, the scope, I heard you say that, but the intent has always been to keep the child with the family. Mm-hmm. And sometimes that's just not the best situation, even though I understand the intent. There are so many more things that I have that I wanted to ask, because I wanted to find out, like, at what point did at what point does the manager know about the case? Because I heard you guys say earlier the caseworker and the supervisor kind of know at the same time. When does the manager know? Can somebody tell me that before I finish my statement?
The manager provides oversight of the whole unit, more of a manager of, or is it certain cases that meet a certain high risk level, the manager will have oversight and staff it more closely than they would any other cases. On a day-to-day basis, a manager might not know the details of every single case or hear about every single case.
So when a case comes in, do they know about the case, just in terms of just generality?
No.
Oh.
So the case assignment goes directly to a worker and a supervisor.
Okay. So at what point does the manager find out? Do she find out if there's a problem or if it's taking too long to close? I mean,
all of those reasons. So initially, it may be so on a weekly basis, the manager receives a report of based on a criteria of these are high risk cases.
Okay.
And these that really need your attention to go in and staff with the worker and the supervisor. It's that. It's if there is a fatality, definitely the manager is called in. The supervisor works that case alongside the worker, a fatality. If there's a media case, if there's a concern by any constituent, if there's a concern by the worker or the supervisor saying, we're really struggling with this case. We need your input. Can we staff with you? It's really those types of situations that are brought to the manager's level.
The manager generally would oversee 5 supervisors in their units of 5 generally. Now, of course, with the vacancies that we have, managers are working outside of that role where they would just be managing and monitoring reports and monitoring that. They're often filling in for supervisors, staffing cases. Supervisors are filling in for workers. So it's unfortunate that people are working outside of their role. in so many instances. Mona and I have been in there staffing cases, holding babies. It looked like a daycare center in there a couple of weeks ago while we were trying to find placements. We need more foster families. We had a very, very encouraging and productive meeting this morning that had been scheduled long before this with many partners from the faith community this morning who came forward and wanted to see how they could help us. And so we have some plans that came from that were really encouraging.
Mitchell Robertson. I want that baby's life to be remembered for something good, even though it may have come out of tragedy.
We agree. We agree.
So there are so many different aspects to everything that you guys have said today. I wish I could leave with some level of confidence of knowing that we are in a better spot. And Madam Secretary, I want to ask, if we gave you, how much money would it take, to make this better? So we can have some level of assurance that at least we have enough people. But even if we gave you the money, I'm not sure if I feel really confident that it would be enough, because if you don't have people who have the level of passion doing the job, then that's something else. But if we paid them a little bit more, maybe that would help some. It's just so many different angles. But what I do know is this. I want to leave here today knowing that there's something different, even though you don't have another dime. And as Senator Jackson said, I totally agree with her. Y'all know I serve on finance. I was not happy when I understood that you guys did not have not one additional dollar in your budget for existing programs, just the new programs that were implemented. And even though those programs are great programs, we still have to make sure that we're taking care of the needs of the people. But the intensity of the needs of the people are growing. I don't even want to ask you how many babies you guys had to bring in. I've been there. I've been at your facilities.
Yes, you have.
When the children are sitting there waiting for somewhere to go. That's so stressful. I do commend the workers who actually do the job, because I could not disconnect from that job and go home and be okay.
Neither can they.
Affects their families.
But for those who have run their course and this is not for them, they need to leave, because in that particular case, I believe someone really should be prosecuted, because that was really negligent. But I don't want his name to be in vain. And at some point, we have to do something. We have to figure out what that needs to look like. And Madam Secretary, if you had more money, do you believe that would really kind of solve at least some of this?
If we had money to hire staff, yes. Senator, I do want to say, because we agree completely with you that Mitchell's death not go in vain. And one thing that we implemented since this tragedy was that Senator Jackson, this goes straight to what you were saying, every child under 3 that we get a medical referral from, we see immediately. No questions asked. If the hospital calls, if a doctor calls, we go.
Yeah, we instituted that policy as a result of this. We had been looking at it. In fact, for over a year, as you all know, we have been reviewing every one of our centralized intake and CPS investigations policy. We have made numerous changes in those policies, added other things, tweaked some, strengthened some. Just since I looked at how many we had that were improved or added, just since June, we had over 20. So it is overwhelming. You have to be able to implement it, but we have to give the good guidance to staff with policy that will protect children and them in the work that they're doing. I do want to give you a little bit of confidence, though, that we have pulled in people. it concerns me because I'm pulling from a place that's standing on one foot, and I'm saying, can you help me? Can you send someone? Had a worker coming here from Shreveport. Today we have more people coming in on the 15th that will form a full team that have committed to 2 months of coming here to help while we try to get others on board. That hiring fair that we had every single hand on board trying to get, we might have 6 people out of that entire thing. And that's 6 who made it through the process, not who have accepted the offers yet. So we're hoping, and that is not just caseworkers. So hopefully we get some from there. I will tell you, we brought in also retired people. So people who have given their life to this work have called and said, I will come back, I will come help. We have people in there right now in that office.
That's good. That's good.
Staffing cases, people who have really good clinical backgrounds, clinical
We
experience.
needed to hear that.
So they are doing that. And then the last thing I will tell you is there is a program that we had started exploring before COVID, and it actually got dismantled sort of during COVID, and now it's coming back. But it's called the Critical Incident Review, and it's an evidence-based program that Casey Family Programs has sponsored along with other federal partners. And it really goes from a perspective of safety science, like the airlines do or medical professionals do, where they create an environment of psychological safety so that people are free to say where were errors made, where were errors in judgment made, and look at the whole system, not just an individual worker or an individual supervisor. And so I will send you the information on that as well if you'd like, because I think that really offers us an opportunity to look at the system as a whole and where there are big opportunities for strengthening it.
And if there is a cost associated with that, we need to know that and make sure it's funded.
Well, medical, I will tell you, well before this, I had been having a lot of conversations with doctors from Our Lady of the Lake Children's Hospital. And so getting medical consultation, I mean, they have said, how do you not have a medical director in your department? We've not ever had a medical director, and I don't know that one medical director would be the answer, but we certainly need access to medical consultation readily available to us. We are having meetings, I think in the next 2 weeks, we're starting meetings with the 6 managed care organizations that are going to be providing Medicaid services, which would be services for our children. And we want to ask each one of them, what would they commit to doing? How will they play a more significant role in helping our staff? What can we count on them to do to help us? And so there are things that are done in other states. For instance, in one state, every time a youth is placed in a foster home, the crisis intervention person, mobile crisis, goes out as a proactive measure and actually introduces himself to both the youth, to the foster parent, and says, I'm here if you need me. And it has cut down tremendously. We have kids who are going into hospitals, being PEC'd, going into emergency rooms way too often because of traumatic incidents and resulting behaviors. And if there was something in place like that, I think it would save the managed care organizations considerable money. So we need to be able to talk with them about where there are opportunities to be proactive in the system and help our staff make better decisions.
I'm so glad I made those comments, because then you made those comments, right? Which gave me some hope, because there looks like some other resolution outside of knowing that we don't have enough money. Madam Secretary, not trying to put you on the spot, but if we were in utopia, what would give you the level of comfort of knowing that you can do and the office can perform the duties that they need to do?
I would love to see 250 more frontline staff immediately. and the central office, the central nervous system of the body. You can't hire people without HR. Our HR staff was gutted. You can't do this work without attorneys. We don't have a fraction of the attorneys we should do. And our attorneys aren't attorneys that sit in the office and deal with lawsuits and contracts. Our attorneys are in the court with the children, in child support cases, in child welfare cases, at every hearing along the way. In child welfare, kids in foster care have hearings every 6 months. So we don't have nearly enough attorneys, and they are spread very thin. So we would need attorneys. We would need the HR people. We would need the contract staff. So it's not just the frontline workers. It's the body that does the work as well. It is that central nervous system. That was what Terry branded it years ago when we were under Governor Blanco, all the support systems that run the contracts, find the providers, visit the providers, make sure they're doing what they're supposed to be doing. All of those pieces aren't on the frontline worker. So just 250 frontline workers wouldn't be a solution. It needs to be a bigger package. I would be thrilled to put that package together and show you that.
I would love to see that, because at the end of the day, while certainly everyone is looking at the Department of Children and Family Services, and rightfully so, but there's a lot of blame, I think, that can be spread around, starting with individuals who knew the family. And did they make calls? Did somebody say something? We have a responsibility, making sure that there is the funding necessary needed so that the job can be carried out. I'm wondering, and so we have the medical society coming up, if there was something that they could have done, law enforcement, because it's my understanding, according to some of the reports that I've heard, that they may have known something. So nobody is off the hook at the end of the day. I think everybody can share responsibility, especially in that last particular case, not the last, well, the first case that we talked about earlier. There's a lot of responsibility to be shared. And so no one should try to criticize anybody else more than anyone else. Because at the end of the day, I think we all can share in some level of that responsibility. But definitely the bulk of the buck stop with you guys.
Yes, it does.
But anyway, that will conclude my comments. And I know Senator Jackson has either a comment or a question.
Just a question very quickly. You're pulling people from Shreveport and other places. Are they within the, their offices within the range of the acceptable caseload?
Their management team has determined that they can allow them to come for this period of time.
Okay, good deal. All right.
Okay. All right. Well, thank you. I don't see any further questions.
Thank
you, members.
Thank you.